Hello everyone. Today we will discuss dengue fever. Again, it is a viral disease, and its pathogen virus is a flavivirus or a arbovirus. And this virus occurs in a four strain. Four wild strains are of a dengue virus or a flavivirus. Strains names are Den V1 to V4. Den V1, Den stands for dengue. V1 strain number 1 and V2 strain number 2, V3 and V4. Actually, this virus does not enter in body directly. It enters in a body by the some other factors, and that is called a vector. That's why it is called vector-borne disease. Vector stands here for disease-causing agent, transferring agent. So this virus is carried by female Aedes aegypti. This virus multiplies in the salivary glands of Aedes aegypti for 14 days, and in salivary glands it get mature. After that, whenever a female suck the blood of a normal person, it release the virus in the blood. That is the mode of infection. So it is caused by flavivirus, but this virus is carried by female Aedes aegypti. It does not separate from person to person by air, by food. It transfers from one person to other person by the mosquito female Aedes aegypti. So its incubation period is 3 to 14 days. So from third day to 14 days it multiplies and replicates. The virus is actually again RNA type. Virus type is RNA type. So when it enters in host cell, first it attached with the host cell and then it deassemble and it forms various copies, means replication of RNA takes place, right? And that process takes 3 to 14 days. After 3 to 14 days symptoms will appear, and it is mostly seen in tropical countries only, tropical and subtropical countries only, and it includes Caribbean countries, Southeast Asia, including India also. Almost 2.8 billion people are affected with dengue fever. So it is a fatal disease again. It may lead to death if left untreated. So treatment of dengue fever must be there, otherwise death will occur. So symptoms, they are divided into two phases. First is febrile phase. Febrile means normal phase. In febrile phase, symptoms appear and last for 3 to 7 days. The symptoms are normal: fever, headache, nausea, muscular and joint pain. Due to muscular and joint pain, unbearable pain occur. That's why dengue fever is also known as a break-bone fever. That's why dengue fever is also known as a break-bone fever. Unbearable pain in muscles and joints. Next, pain behind the eyes. At the back of eyes there is a unbearable pain and rashes on chest. That is the indication a person is suffering from a dengue fever. In some cases rashes does not appear, but in 50% cases rashes appear. Red spot on the skin. This is the normal phase, febrile phase. Patient can be recovered easily if he is suffering from only febrile phase. But the second phase is a critical phase. As the name indicates, it is a lethal and fatal. But all the patient does not get a critical phase. The persons who had already first infection of dengue fever, after 18 months they may get secondary infection of dengue fever. So critical phase occur only in the person who had already infected once and the virus repeated in their body again by the second strain, by the third strain, and a fourth strain. This phase is quite crucial. The symptoms are high sustained fever, fever temperature remains high, 38.5 degrees Celsius. That is quite high fever. Vomiting, leukocytopenia. Leukocyto means WBC. WBC is our soldier of the body, main immunity cells. Penia stands for decrease. So there is a decrease in immunity cells. So definitely immunity will down. Thrombocytopenia. Thrombocyto means platelets. Penia again decrease. So platelet count will decrease. That is also called as critical platelet count. So thrombocytopenia is also called as a critical platelet count, CPC, critical platelet count. It indicates the person must be admitted in the hospital for further treatment. In some patients, some serious symptoms arise like shock. Shock occurs by vascular leakage, circulatory system. There is a leakage in circular system as the blood will not supply, so organ starts starving and dying. So there may be case of liver failure, kidney failure. That's why this dengue fever is also known as a dengue hemorrhagic fever, DHF. Dengue hemorrhagic fever means bleeding in body, bleeding in stool, bleeding in nose, bleeding in intestinal tract. So this hemorrhagic condition arises by the bleeding in nose, stool and gut. Alimentary canal means our gut. So you can understand why it is known as a hemorrhagic fever. And due to shock condition, due to failures of organs, this is also dengue fever is also known as a DSS, dengue shock syndrome. So this DSS is dengue shock syndrome. So you can understand the person will die if no treatment will be given to that patient. And treatment, first is serology. How dengue fever is detected, how virus is detected. Virus is detected by two tests. First is NS1. NS1 means non-supportive antigen produced by flavi or arbovirus. As it enters in body on first day, it produces antigens, and those are non-supportive antigens, non-supportive proteins that can be detected in a blood, that will indicate person is suffering from a dengue fever. Second test is detection of anti-dengue IgM, immunoglobulin type M, and it can be detected at the day 4 of infection. At the day 4 of infection, by these two tests, this dengue fever can be confirmed in a patient. So how to treat a dengue patient? The treatment is, for pain relief, you can use paracetamol. To reduce body temperature, you can use paracetamol, and you can so use acetaminophen. It will give relief from the pain. This is pain reliever, and this is antipyretic. Antipyretic means temperature down, and pain reliever means relief from the pains. As we have discussed, there is a serious pain in muscles and joints, right? And one good news, prevention of dengue fever is possible. A new discovered vaccine is available. Dengue vaccine can be introduced in the patient to prevent him from dengue fever, but it is effective only in 70% cases. One more point to be noted, patients should avoid aspirin and ibuprofen. They should avoid intake of aspirin and ibuprofen because both are anticoagulant. They both are steroids and they are anticoagulant. So coagulation of blood will not take place, as there is already decrease in platelets, and we know platelets cause blood clotting. So both these will favor the further decrease in platelets count. So these two drugs must be avoidable. You can use acetaminophen and paracetamol, but these steroids and these anticoagulation drugs must be avoided. And the last possible prevention is introduction of dengue vaccine in a patient. And further precautions can be used. Use anti-repellent, wear long sleeve shirts whenever you go outside, maintain a life with hygienic style. So that's it for a dengue fever, right? So in next segment we will discuss HIV, viral disease number 4. That's it for dengue fever.